I've lived in the UK for 6 years, and one thing I've noticed is that you hardly find ants crawling. You can leave a cube of sugar on the table for a week and you wouldn't see any ants gravitate towards it. Talking about ants, I remember having a patient many years ago who came to my clinic and told me that the brother had told me that he's noticed that this particular patient of mine, a young boy, each time he goes to the toilet to urinate, ants will crawl into the toilet. And down, they were really worried about that. So as soon as I got that history, I was thinking, could it be diabetes? Because what it means is that there's sugar in this boy's urine, what we call glycosuria. That was the first time. Obviously, as before going into med school, you always hear people say, "Oh, sugar." Of course, that we all know that diabetes is high blood sugar, and there can be sugar in the urine. But that was the first time, working in the capacity of a doctor, that I saw someone actually come to tell me that ants were crawling into the toilet whenever that young boy, urinated. Lo and behold, we tested his urine, high blood sugar in his urine, tested his blood, high blood sugar. He was diagnosed with diabetes. That was a very painful experience for me, seeing such a young boy, being diagnosed with diabetes, knowing how challenging, the management of diabetes, really type 1 diabetes is, and the ordeals, he would have to go through managing that. I felt so sad, but thinking about it, I was like, if that boy was living in a country like the UK, where it's a country that's very cold, where ants are not usually seen outside crawling, that history may not have come, and maybe his diagnosis wouldn't have been as early as it was. So thanks to the ants really helped in ensuring that his diagnosis was made early, and obviously we started him on the right treatment as early as possible. So ants can be good as well.